So as Ted mentions, this conference, I think, probably takes months to put on. I have to thank the Supportive Housing Network for inviting OASAS to be here, but I also am thinking about 20 years ago when we first heard of Shelter Plus Care. And many of us got to write those first applications, and to sit in a room with you and see the magnitude of permanent supportive housing and the presence of people that I've known for over the past 20 years is just a thrill for me professionally. So thank you, Ted, for inviting me. I really am proud to be here. And man, is that scary to see yourself so big on TV. Oh, I should have brushed my hair. Okay. I want to congratulate the network on 12 years of an annual conference. This is really wonderful, and I think your dedication to making sure that supportive housing is accessible to all communities in New York State is really something to be proud of. I know that permanent supportive housing is a key component to improving the health care of individuals, and as Jason mentioned, this is important to thousands of New Yorkers, and we see the connection, you know. So you heard the big news, and indeed the OASAS system of care has been able to get a $5 million appropriation from this MRT budget, and we're thrilled with that. That will mean that 400 or so new housing units will be in our system of care this year, and that really speaks to, I think, the expensive and oftentimes difficult nature of the population that we serve, and that this will really help on the acute inpatient detoxification stays, emergency room stays, and then the inpatient psychiatric care that people are receiving. That, as we all know, that tends to be our sickest population, the highest needs, and of course the highest costs in Medicaid dollars. So this is great news. And OASAS has a great history with making sure that the units that we provide to you as providers have got some supports with them as well. So our model will continue to have the mutual support piece, the real focus on recovery. It will continue to have housing counselors with evening and weekend availability to really help with those crisis nights. We also will continue with job counselors and an individualized, tailored approach for employment. We have a great record with folks that we place in supported housing. You probably know this, that almost 50% of the folks that are in our system right now are either employed or in receiving some sort of degree, college degree. So that's 50% of the folks. That's a great number, and we know that with the addition of these beds, we're going to have more of that. Quality assurance is important, which is why OASAS really pays for that clinical supervision. We believe in motivational interviewing, the evidence-based practices that really help people connect clinically with their outpatient system and even more importantly, with their families to help them reunify. And so this is a wonderful program that allows for that flexibility and really lets the populations similar to the mental health folks have what they need in order to be successful. So OASAS is going to provide operational budget support, rental subsidies, housing counseling, job counseling, like I mentioned. And we're hoping that June will be the release of the RFPs. That'll be in the New York City area, RFAs in the Hudson Valley, Long Island, Westchester, and in the upstate counties. So we're looking for an October award letter. And I just have to mention that OASAS for the last 5 years has really made great strides in the housing stock. I think we maybe had 800 units in 2007. You know, with this MRT appropriation, we're going to be having closer to 2,000 units. We're thrilled about that, and under the leadership of our commissioner, and I'm sorry that she's not here today, but I'm thrilled to be here. It's Arlene Gonzalez-Sanchez. She really wanted to emphasize the importance of recovery and peer services as we look at the future of health homes and some of the work that we need to connect with care management. I'm excited to say, too, that this particular plan really emphasizes the need to look, as Ted said, at homelessness and, of course, the societal issues of public health and important substance use disorders. And we see those as key to the success of this. Lastly, I have to acknowledge Bill Panapinto, who is sitting to my left somewhere, I think. Yes, please clap for him. He's the Housing Director Bureau at OASAS, and really through his leadership He came back into government. We know that a lot of the good work that has happened has been because of him, so I'm really appreciative. Thank you, Bill. And the OASAS vision for the MRT, permanent supportive housing, is that safe, affordable housing along with stable living wage employment, and most importantly, self-chosen recovery plan are really the keys to the success here of long-term recovery. And we believe that this $5 million appropriation of MRT money, thanks to the governor and to Jason and that wonderful MRT design team, is going to take us one step closer. Thank you.